In northern Ghana, livestock rearing is an important livelihood, generating income and promoting food security for smallhold farmers. But diseases threaten this livelihood. Farmers use EVM to manage livestock diseases on their farms, which has not received significant support. ACDEB identified Sadia Yakubu, an EVM innovator, and working with her to improve her EVM for the prevention of Newcastle Disease (NCD).
My name is Ben Kasim Oumbla, the project coordinator for the EVM project. The project, when I say EVM, it has a long name. The project name is Promoting Ethnoveterinary Medicine for Sustainable Animal Husbandry in Northern Ghana. Doing this project, we aim at improving the health, the production and productivity of rural livestock farmers' animals, so that they integrate ethnoveterinary medicine alongside conventional veterinary medicine. This project is being funded by Mizero in Germany. If you look at the project goal, it is anchored in on 3 legs. So, as one of the legs is for us to generate evidence about the efficacy of EVM. And in generating the evidence about EVM innovations, we need to work with various relevant stakeholders. And so in trying to achieve this objective of the project, we are working with a host of partners, including Animal Research Institute of the CSIR. We are also working with University for Development Studies. We are working with the Central Veterinary Lab. We're also working with Center for Plant Medicine Research in Mamprusi. All these, as well as the Veterinary Services Department of the Ministry of Food and Agriculture. So all these activities we are collaboratively doing are aimed at generating the evidence, doing the tests, doing experiments with farmers on farm, on station, using the various EVMs or innovations to experiment to see if the innovation is actually treating the disease the innovators have indicated. And so we also have an international partner, Swiss TPH in Switzerland, who is providing backstopping support for us to be able to execute the project.
In Wulugu, poultry not only provides for families and households with protein from the eggs and meat, it is income and security for many families. For years, Newcastle disease threatens this way of life, wiping out birds and pushing households into hardship. But one woman decided she would not continue losing her flock. Sadia grew up learning poultry care from her father and grandparents.
I'm Sadia Yakubu. I'm an innovator and then also a farmer. I rear poultry birds and also into crop farming. So to me, I can basically say that poultry has been so helpful. I got my school items through poultry rearing. And aside that, we fed on poultry as well. I learned a lot of knowledge from my parents as farmers, and then one of the most important one is learning how to diagnose poultry disease and going to the bush to bring herbs. When I was challenged in that regard, I also thought of going in for these herbs and adding a little bit of research, getting to know the medicinal values of the ingredients that they used to use, and then adding my own based on the medicinal values.
Those early lessons stayed with her, especially when her own birds fell sick.
Before my innovation, I experienced a lot of Newcastle disease deaths in my farm, and then I was always running at a loss. I wasn't facing the problem alone, but together with other farmers within my community and the neighborhood.
Like many farmers, she watched her birds die almost overnight. The losses were painful, both emotionally and financially.
So being a farmer comes with a lot of challenges, and then in 2020 I bought broilers to rear for the festive season, and then there came this Newcastle disease outbreak in my farm. So I bought 400 birds, and out of that I lost half of the total stock. So it was a very challenging moment for me.
Sadia began creating a herbal medicine using local plants and spices. She tested, adjusted, and refined the formula until she saw results.
I was motivated to come out with this innovation, following the COVID outbreak. In 2020, a lot of synthetic medications were very expensive and sometimes not easy to come by. And looking at where I am based, it was so challenging. You have to either go to Tamale or Bolga, and all these things, when you want to deduct them, you are making no profits and you are in business. So to make profit and also to be able to access this vaccine and then to reduce cost, I thought of going back to revisit what we used to do, and then from there I came out with the Newcastle disease decoction, of which I'm not the only person benefiting, but other farmers within.
It is simple to prepare, affordable, and uses ingredients found in almost every household.
In coming out with this Newcastle disease decoction, you need black pepper, you need cayenne pepper, you need gloves, you need ginger, you need garlic, you need bitter cola, and you also need aloe vera. So you crush all these ingredients with the exception of the aloe vera, grind them and sieve them. Mix with the wood ash solution, that is the potash. You also need to kind of slash the aloe vera to remove the liquid, sieve it, and mix all these things together. So when the preparations is done, I then add preservatives to it.
ACDEP, through EVM project, identifies local ideas, tests them with farmers, and strengthens what works. Sadia was selected as one of the community innovators.
ACDEP have been supportive over the years. They supported me with trainings on how to identify and diagnose animal diseases. I also got the privilege to learn about how to manage my business well through entrepreneurship training. They supported me together with others to experiment my innovation with some other farmers, and through that a lot of farmers have heard of this innovation, and also from their own experiences as they use the decoction are now calling on for this. It has really impacted me and then impacted the communities in which we held this experiment, because mortality or Newcastle disease death rates got reduced over the years as they were experimenting it. We also did the on-station experiment, and then feedback was given together with the community feedback. So I think ACDEP is doing a wonderful job.
ACDEP, in collaboration with animal research and other stakeholders, studied ethnoveterinary innovation from Walwale area that the innovator said it can be used to treat Newcastle disease. We assess the efficacy of that particular Newcastle disease innovation, and so we used the medication. We made her to prepare the medication, and we also selected 10 communities among the communities in Walwale area, and in each of the 10 communities we selected 6 farmers, and their chicken were used for this study on farm. And then we gave the medication to the farmers, and they put it in the water of the chickens that they drink. This was done consecutively for 3 days and then replaced for another 7 days. We repeated this particular medication for preventing and treatment of Newcastle disease for 3 months. At the end of the study, we observed that morbidity was low, about 9%, that is those who got sick, and about 14% also had mortality among the bears that we studied. We took the blood samples of the bears and it was sent to Central Veterinary College Laboratory at Pontamale, and then they studied the blood to determine the antibody levels of the chicken, and that is their ability to fight against disease in the environment. And from the beginning, we took the blood periodically for about 6 times. As we began the study, the antibody levels was low, and as we continued the study towards the end, the antibody level was high, and we believe that it was because of the medication that helped increase the antibody level and also lowered the morbidity and the mortality that we observed.
Women say her herbal medicine keeps the birds healthy and it is easy to use. For many households, this means more food and more income.
I can't talk less about the economic importance of the innovation to my family. It has helped us increase our income through the sales of the bears, and then also people getting to know how effective the decoction is and buying from us. This has really helped me to support my siblings in school and also to provide for my family in terms of food and other necessities.
Manya fukwarwa kanya wa nguna teman panda mana gulo ma kan kunyati kan sungniti ya ma ka no soa ni pinwa na to ma gula had pam ka piayi ko tichana wa ka doron sahan kunwa no suma ko pirini ko pira ai ko wala yu mala wa suna ai kan da ko to non to zoblo ma man no suma ne pinima na bun yara matima ai kan da wani jikara zuwan pawo amma ku ya ci ma mannan nan ku wala yu mala suna ai ko kai ku tupana wa ai no ma blan kira ai de bira musa za ani ku balgani ka anyangi pap don pap no suma pun ka nyangna mangu han bi sacrifice kam mamang zanchan te mamang te pun yara pam yara katun yara apuni nyara ndi anta te yara musa so uchi ma via pam.
Sadia's story shows the power of local knowledge and how one farmer's idea can strengthen an entire community.
I hope to improve upon my innovation by refining the process of making it, either into powder, into tablets, for easy carrying. Myself personally and the farmers we experimented this innovation with, sometimes we're challenged with the weight of the 5-liter jerrycan. It was too heavy for easy carrying. So I hope that I hope to work on, or I hope to get assistance to work on the to work on refining it to either tabs or powder or something liquid but very effective in a small bottle for easy carrying.
And so we believe the EVM innovation can help improve bears' productivity and can also increase the incomes of farmers. So we urge other stakeholders that can contribute to its usage, especially the veterinary officers. They can collaborate with those innovators to see how they can help farmers to replace or to use them wherever they can get the orthodox medications to use. I think this is good and can be used among the farmers.